Introducing Nicola and Kelly. So Nicola Gillies is a lecturer in nutrition at the Faculty of Medical Health Sciences at the University of Auckland. She's a mixed methods researcher and a New Zealand registered dietitian. Kelly McQuinlan is the president of Ehlers-Danlos Syndromes, Aotearoa, New Zealand. She's a Bachelor of Science at the University of Auckland, and she was diagnosed with hypermobile EDS with vascular issues at the age of 25.
So it's a real pleasure to be here, and especially with Kelly as well. So what we're going to do today is give a bit of an overview about what EDS is, just in case you aren't familiar with it, as well as an overview of our research program at the moment and how it came to be and how it's sort of snowballed very quickly as we've gone through, some of the kind of underpinning methodologies and how we're doing our research as well. Without further ado, I will hand over to our expert who will be able to share what EDS is.
Kia ora. So Ehlers-Danlos is a rare connective tissue disorder. Currently it has 13 subtypes, but that will be changing probably at the end of the year depending on what the new diagnostic criteria brings. But it comes with a whole bunch of comorbidities. Quite a few of them are quite rare. And so it is a multi-systemic condition, so we have lots of issues going on. We have pain, dislocations, gastro issues, headache issues. If it's got connective tissue, which is everywhere in our body, it could be impacted. So our most prevalent type is hypermobile type, which I think it's recorded at 1 in 2,500 at the moment, but because of underdiagnosis and lack of understanding in New Zealand in particular, it should be around 1 in 500, but that's where we're standing at the moment. And our rarest type is 1 in 200,000, and that one in particular, the vascular type, can threaten people's lives. So having the right information, the right research, and the right support for clinicians as well is extremely important for those sort of long-term health outcomes for our community.
Cool. Thanks, Kelly. And just to position our research in this, so we're we are focusing in on the hypermobile type of EDS, and we know that sits on a phenotypic spectrum with hypermobility spectrum disorders. So that's not to say someone with hypermobility spectrum disorder or HSD has less severe symptoms, it just doesn't quite fit with the same diagnostic criteria. So this is sort of reported as a phenotypic spectrum or continuum in the research. So we're focusing on people with HEDS or HSD. As much as possible in our research, we're trying to be open to either suspected or diagnosed conditions because we know of the diagnostic challenges here in New Zealand. There are some projects where we need a kind of cleaner way to characterise our sample when it comes to publishing, so we do rely on just diagnosed HEDS or HSD. But just to give I guess a bit of a timeline of how this research came about and where we've got into, and I would say a relatively short time frame. And like I said, this has really snowballed once it started, and once we started connecting in with other people, we've just really grown, I think, a really strong group of researchers with similar values and interests, and most of us either have lived experience or some, like kind of 1 degree of separation with someone with lived experience as well. So for me, this research, the questions or the ideas started with my clinical experience. So I was working as a dietitian in a gastro clinic, and I was seeing not a lot, but more and more people coming through with HEDS and a whole list of these comorbidities that Kelly was describing. And very quickly realised that there was very limited research, no clinical guidelines to work with, and people were just really struggling. They were really struggling with their food and not getting the support that they needed, and I felt ill-equipped without having guidelines or research to lean on as well. So in about July, I was piecing through my emails the other day, but in around July 2024, we connected in with Rare Disorders New Zealand. We had a meeting with Kim, and she was really helpful in connecting us with the data from the white paper, and also being able to pull out EDS-specific data from the white paper to help inform a research grant We also connected in with Kelly and met with Kelly and some of her team within the clinical network of EDS New Zealand, and just established a working relationship, and that what I was seeing in clinic and my thoughts around where the research could go was an issue of concern for the community as well. And we put together an application for the HRC Health Activation Grants, which are no longer in existence, but this was a really wonderful way to get this research off the ground. There's smallish grants, $30,000, but I think you can do a lot with $30,000 and the right people and supports in place. So we got that health activation grant in October, and then we started connecting in with other researchers, and so Natalia is one of them, and we were able to leverage this project to get a bit of extra funding from the Early Research Network at the University of Auckland to look at the IDI data set. And like Natalia was mentioning, we know gut symptoms are an issue. We know people with EDS face a whole range of dietary challenges, but we suspect that people aren't really accessing public services like they should be able to, and we were also interested in whether there were any inequities within the EDS population as well. More recently, we've connected in with a wonderful researcher, Angela Upstill, who's based at the University of Otago. She's a physiotherapist by training, I think, but sits within the pain services. And with Debbie Bean at AUT have received some internal funding to look at diagnostic journeys, healthcare experiences a bit more broadly than just a focus in on nutrition. So I'll pass over to Kelly to kick us off here, but this is really our underpinning methodology. I'll talk you through. We've got a lot of different ways that we do our research, but we've got community-based participatory research, or CBPR, is really at the core of what we do and how we do it.
Yeah, so I mean, for our patients here, you'd know about the nothing about us without us. We find it incredibly important, especially from a from a support lead perspective, knowing how important being there before things start, because if we're not informed from the beginning, it's very hard to get our thoughts into research after things have started. So we really appreciate connecting with researchers before it even gets off the ground, because you're creating it the right way with the right outcomes planned. A part of this whole situation, I've got the picture of our core network up here as well, so I'll just quickly touch on that. So a part of the Nothing About Us Without Us, I mean, it's also connecting our clinicians and also connecting anyone that's basically dealing with our community. So I have a bunch of clinicians around New Zealand that connect with each other, talk with each other, and figure out how to strengthen the sort of community experience. But after talking to researchers, realising that they actually don't mind connecting with each other, they're not scared of each other, we've also been able to connect quite a few of our researchers together, and that's how we've been able to sort of connect you with Natalia and some other people like Angela as well. Well, you'll connect with Angela previously. But we talk together, they figure out how they can strengthen each other's work, and I think that's also a part of the Nothing About Us Without Us, because we're just everyone in the community with our community in mind as the forefront is incredibly important for our patient outcomes.
Thanks, Kelly. So in the research literature, there's a whole range of principles associated with CBPR, but I think really at the crux of it is centering lived experience as valid and respected alongside academic and clinical knowledge. And to us, it really just means working with and for the community. And Kelly and I were having a chat just before as well around how CBPR does conceptually align really nicely with Māori research ethics and principles here in Aotearoa, New Zealand as well. So it is a really robust framework to work with for us. Appropriate, meaningful too. So here's a little bit about the research that we've got in our HRC activation grant. So there's 4 key pieces to it. The project is called Exploring Perspectives and Priorities for Nutrition Research in EDS in Aotearoa, New Zealand. It's really just scoping the landscape. So we've got, up until now, there has been no research looking at very limited research around EDS in general, but none around diet and EDS and what the landscape is here. So we've started very kind of broad brush strokes, I suppose, to inform our thinking about where we might want to zone in on with our next steps. So we started with a couple of surveys. So one was with the EDS community and one was with dietitians as well. So with the EDS community, it was an anonymous online survey, kind of quantitative and qualitative responses available, some really rich qual insights in there, even though a survey is not the best way to get that sort of data. But yeah, we were looking at things like access to nutrition related information, whether they were seeing health professionals for nutrition related health care, what their challenges are, what their needs are, where they'd like future research to go. We got around 200 responses for that survey, and we have started analysing that, and we're just pulling it together into a manuscript at the moment. With our dietitian survey, this was looking at knowledge, attitudes and practices. So I think for me, I wear a couple of hats in this research space, and I feel like I walk a bit of a tightrope sometimes between doing research that's meaningful for the community but also helpful for clinicians too, because I know both sides are struggling at the moment. And so we have around 25 dietitians, I think, who completed that survey working in both public and private settings. The third piece of this project is qualitative research. So once we've developed a bit of our thinking through these first two surveys, and now we're digging into healthcare experiences a little bit more in this project. So we're using photo voice methodology combined with interviews and focus groups. So you may or may not be familiar with photo voice, but it's a creative way to take, I guess, pressure off words and illustrate your understanding, your values, your experiences through a different medium, and then you can use those photos as a discussion point when it comes to the interviews. It's a really beautiful way to do research. We've used it in the food and mental health space before as well. So we're currently just recruiting for this project here. So we'll hopefully at some point in the future be able to update you on that. And then the program as a whole, I guess, culminates in the formation of an advisory group. So this will be 10 to 15 people, so people with lived experience, advocacy groups like EDS New Zealand, trusted clinicians, carers, all coming together, and what we'll be doing is presenting a summary of the findings so far and talking about different ways that we can and should be disseminating the findings to these different groups, as well as what some, good next steps are. Just to give you a taste of some of the additional work we've got, so Natalia mentioned the IDI project that we've got, and we've been able to link this in with our photo voice and interview project to be a really nice mixed methods master's project to explore healthcare experiences or nutrition related healthcare experiences. I've been able to patch together bits of money to create a cross-sectional study which will look comprehensively at dietary intake and gut symptoms in people with diagnosed HEDS and HSD, and we've got a master's student working on that. And then, like I mentioned, the work with AUT and the University of Otago. I guess eventually the end goal for us, and we keep talking about as well, is evidence-informed, context-specific guidelines. So that would be a nice thing to have, isn't it? But to improve healthcare and health outcomes for people with HEDS, HSD, EDS in general in Aotearoa, New Zealand. I'll hand over to you first. Yeah.
Yes. One of our mottos is "Together we dazzle." Stronger together. Let's dazzle is our motto for our organisation. But it just really speaks to the fact that it's actually a good thing to work with lived experience. People with the lived experience we class as experts by experience. So I very much try and champion the fact that we are very important in making sure that research is really important and it's done the right way from the beginning. So if you are researchers in the room or online, I suggest connecting with the community as much as you can. We can often give, just the feedback I've got, that we can often give different perspectives that maybe researchers in a clinical setting haven't potentially looked at in the past, or maybe we as a community need to reconsider that we're maybe putting our thoughts a bit too further than we actually need to. Or it's a great marry up, and I think you guys really should be working with people with lived experience as well. So
yeah, we couldn't do this research without. I appreciate that Kelly is probably a bit of a unicorn. She's very generous with her time. We do have her as a research assistant on this project, so we do have some funded time, but I think you'd do it regardless. She's been so helpful in informing our research, connecting us with the community as well. Never have I ever thought it would be possible to fully recruit for a study within a day. Like, it is incredible. This group really comes together, and I think having Kelly as this conduit between both worlds has been really important, because there is a lot of distrust between the EDS community and the medical profession, and we as researchers are kind of part of that medical profession, right? So to be able to work in this space in a really collaborative way has been so important for us. I think we're bang on for time. Look at that.